Sponsored by Ward MD and Form Derm Spa. I am here chatting with Dr. Ward and Dr. Powers with Ward MD. Thank you both for being here.
Thanks for having us.
Yeah, thank you.
We're so excited to have you. Okay, there's a new woman in town, Dr. Ward. Do you want to introduce her?
There is. So Dr. Bethany Powers has just recently joined our practice, and we could not be happier.
Well, she's just wonderful. Now, Bethany, tell me why you wanted to join Ward MD.
Yeah, so I've been a kind of longtime admirer of Dan Ward's work and really what he's doing here in the Salt Lake City area. And really talking with some of my mentors, they really recommended that he would be a great person to work with. And I feel like that's 100% true.
Incredible. Now, you do facial plastic surgery. Tell me about your background.
Yeah, so my background is in otolaryngology, or head and neck surgery, and ENT, or ear, nose, throat surgery is kind of the layman's term for it. And so that's specific training in only the head and neck region, and then more specifically I went on to do a facial plastic surgery fellowship. So again, we only specialize from the clavicles up.
Okay, now why did you want to move into this area?
Yeah, so it's really a detail-oriented area, and I feel like it's one of those places that you make such a big impact. You know, the face is how we present ourselves, and I think that that's just such a meaningful line of work for me.
Sure. Now, do you have any favorite types of surgeries to perform?
Yeah, so my favorite surgery is rhinoplasty. Much like Dr. Ward, I really enjoy that, you know, any one suture that you place really changes the shape of the nose. And I kind of, you know, touched on, we usually think about the nose as being kind of complementary, but really you're not looking, your eye's not drawn to it.
Right.
And so really it's just kind of making sure that that's in harmony with the face so that the eyes and the lips stand out.
Well, and I'm sure with new technology, it's changed over time, right? How has rhinoplasty changed?
Yeah, so rhinoplasty used to be very destructive. It used to be that we removed a lot of cartilage and left people with kind of a lot more downtime, a harder recovery, and again, kind of a nose that shifted over time. And really that's changed over the years so that we are building strong noses that are going to last into people's 80s and 90s and really, you know, fit their face.
Sure. Now, Dr. Ward, I'm sure you're so excited to have her at your practice. Tell me about that.
We couldn't be more thrilled. Dr. Powers trained with two of the facial plastic surgeons that I admire the very most in the world with her residency. And then she also, for her fellowship, trained with one of the real thought leaders who's just pushing everything forward in facial plastic surgery. So we are so lucky to have her in our practice, and I think that, you know, that everybody here in Utah and the Intermountain West is lucky to have her.
Yes, we're so lucky to have you, Dr. Powers. Now, if we want to come into Ward MD, tell me the other services you offer.
So we really offer, Dr. Powers and I offer only facial plastic surgery. So rhinoplasty, facelift, eyelids, hair, that sort of thing. We have other providers who do skin, who do body, who do other things, but our focus, specifically the two of us, is only on the face.
Well, and if you have someone sitting at home thinking, you know what, this area is bothering me, I would like maybe some upgrading, can they come in and have a consultation? What's the best way to do that?
For sure. So the best way is to go to our website, wardmd.com, or look for us on Instagram.
And Dr. Powers, with so many treatments out there, what are the trending ones you're seeing right now?
Yeah, and we've kind of talked about this, that, you know, over the last 15 years, a lot of non-surgical options were really starting to get popular, but really we're starting to see people looking for more permanent options, such as a surgical option. And so one thing that we offer is facial contouring. And so facial contouring is where we redistribute the fat. Oftentimes we have some fat that lives here, and we redistribute that fat and actually bring that up to the cheek to make it a little bit more kind of a heart-shaped face. And then we also can go in and contour the neck at the same time. We also are seeing a trend towards lip lifts. And so patients are kind of getting away from doing filler over and over and over, and they really like the look of the filler, but really they're looking for that more permanent option with a lip lift.
Oh, that is a great option to have. Now, if people want to make a consultation right now, Dr. Ward, where can they go?
So call or text us at 801-513-FACE.
Perfect. Great to see you both. And Dr. Powers, welcome to Utah.
Thank you so much. Appreciate it.